Welcome to another episode from the Veterinary Research Channel. Today, we're diving into some fascinating research that could really change how we understand and manage respiratory distress in our feline patients. As many of us know, cats experiencing breathing difficulties can be incredibly delicate, and trying to monitor them without causing further stress can be a real challenge.
That's absolutely right, Brian. When a cat is struggling to breathe, the last thing we want to do is subject them to invasive or stressful procedures. Traditionally, we've often relied on simply counting their respiratory rate and making subjective assessments of their breathing effort. However, this approach has its limitations.
Exactly. Think about it. Just observing a cat's breathing might not always give us the full picture of how hard they're actually working to get air in and out. In human medicine, a measurement called minute volume, which is the total amount of air a person breathes in or out per minute, has been used to help assess the severity of breathing difficulties. But until recently, we haven't had a clear understanding of how this relates to respiratory distress in cats in a clinical setting.
That's where this really interesting study comes in. Researchers set out to investigate whether cats with respiratory distress would show higher minute volume compared to healthy cats, and if this increase could tell us anything about their chances of survival. They used a technique called barometric whole-body plethysmography.
Now, that's a bit of a mouthful. But essentially, barometric whole-body plethysmography is a non-invasive way to assess a cat's breathing while they are in a comfortable, unrestrained chamber. This minimizes stress, which is so important when dealing with these fragile patients. The system detects changes in pressure within the chamber as the cat breathes, which allows researchers to measure various aspects of their ventilation.
So, they recruited 52 cats who were showing signs of respiratory distress due to various underlying conditions, such as lung problems, issues in the space around the lungs, or obstructions in their airways. They compared these cats to a group of 14 healthy cats that had been part of previous studies in the same laboratory.
And what did they find? Well, the results were quite significant. The study showed that cats with respiratory distress had a considerably higher minute volume per kilogram of body weight compared to the healthy control cats. The average minute volume per kilogram was 397 milliliters in the distressed cats, while it was only 269 milliliters in the normal cats.
That's a pretty substantial difference. And it wasn't just an overall trend. The researchers also looked at different causes of respiratory distress. They found that cats with lower airway obstruction, lung parenchymal disease, and pleural space disease all tended to have higher minute volumes per kilogram than normal. Interestingly, cats with upper airway obstructions had minute volumes similar to the healthy cats.
That's a key point, Andrew. It suggests that the underlying cause of the respiratory distress can influence the minute volume. The researchers even determined a cutoff value of 373 milliliters per kilogram. They found that cats above this value were likely to have abnormally increased breathing effort with a good level of sensitivity and specificity.
So, this minute volume measurement could potentially give us an objective way to identify when a cat is working harder to breathe than it should be. But perhaps even more importantly, the study looked at whether this increased minute volume had any connection to the cat's outcomes.
And it did. After taking into account other factors like age, the researchers found that minute volume per kilogram was independently associated with an increased risk of death related to cardiorespiratory issues. For every 100 milliliter per kilogram increase in minute volume, the risk of cardiorespiratory mortality increased by about 1.17 times.
That's a really powerful finding, Brian. It suggests that this relatively simple, non-invasive measurement could not only help us identify cats with increased breathing effort, but also give us valuable insights into their prognosis.
Exactly. The researchers concluded that measuring minute volume using barometric whole-body plethysmography can be a useful tool for quantifying breathing effort in cats. This objective measurement could serve as a prognostic indicator to help us monitor cats experiencing respiratory distress.
In their discussion, the authors highlight that minute volume reflects the total output of the respiratory system, influenced by both the rate and depth of breaths. When a cat's ability to exchange gases is compromised, they need to breathe more to try and compensate and maintain adequate oxygen and carbon dioxide levels. This compensatory increase in minute volume, as measured by barometric whole-body plethysmography, appears to be linked to a poorer prognosis.
They also point out the challenges of relying solely on respiratory rate. While a rapid breathing rate, or tachypnea, is often seen in cats with respiratory distress, it can also be caused by stress or excitement, making it difficult to interpret in isolation. Furthermore, different underlying conditions can lead to different breathing patterns. For example, restrictive lung diseases might cause rapid, shallow breaths, while obstructive airway diseases could lead to slower breaths with prolonged inspiratory or expiratory phases.
So, having an objective measure like minute volume, which takes into account both the rate and the depth of breathing, could provide a more comprehensive assessment of a cat's ventilatory status. And the fact that barometric whole-body plethysmography allows for this assessment in a non-restrained environment is a significant advantage, minimizing stress for these vulnerable patients.
The researchers also discussed why cats with upper airway obstruction didn't show the same increase in minute volume as those with other conditions. They speculated that the loud breathing noises often associated with upper airway issues might lead owners to seek veterinary care earlier in the course of the disease, before the cat develops significant breathing compromise.
That's an interesting thought. And they also acknowledged some limitations of their study. For instance, they didn't include cats with the most severe respiratory distress who required immediate interventions like intubation or chest taps. Cats with congestive heart failure were also underrepresented in their study population. Therefore, it's important to consider that these findings might not directly apply to all cats with respiratory distress.
Absolutely. They also mentioned that factors like the time of day the measurements were taken could potentially influence the results, although it's unclear if this has a significant impact in clinical settings. Despite these limitations, the study provides valuable evidence for the clinical utility of barometric whole-body plethysmography in assessing breathing effort and predicting prognosis in cats with various causes of respiratory distress.
Overall, this research highlights the potential of using minute volume, measured non-invasively through barometric whole-body plethysmography, as a valuable tool in our assessment and management of feline respiratory distress. It offers an objective way to quantify breathing effort and provides important prognostic information that goes beyond traditional methods like simply counting respiratory rate. This study truly underscores the importance of continued research in veterinary medicine to find better ways to diagnose, monitor, and ultimately improve the outcomes for our animal patients. The ability to non-invasively assess such a critical parameter as breathing effort is a significant step forward in feline respiratory care.
Agreed. It's exciting to see how these advanced techniques can be applied in a clinical setting to provide us with more objective data and help us make more informed decisions for our feline patients in respiratory distress. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.